hospital administrative staff saying that it's extremely difficult to find quality nurses. They go to the Gulf, they go to European countries, and especially so after COVID, that hospitals are feeling the crunch about nursing staff.
It's a serious problem. The serious problem is because in US and Europe, for every doctor, there are 4 to 5 nurses. In India, for every doctor, there is 1.7 nurses, not even 2. Already. Now, across the worldwide, there is a shortage of over 80 million health workers. In England, this year, I think this year or middle of next year, over 2 lakh nurses are going to retire. And they may not be producing more than 10-20,000 nurses. Where are they going to find the nurses? They are going to take it from India. So in India, when we plan the healthcare workforce, we can't look at what is the India's requirement. We have to look at the global requirement. An English nurse or a doctor will never go to US. A US nurse or a doctor will never go to England. But Indian nurses are happy to go anywhere in the world. Indian doctors are happy to go to any part of the world. We are very comfortable and we have a brand as healers. In US, patients who are treated by Indian doctors, expat doctors, mainly Indians, live longer than the Americans who are treated by American doctors.
Amazing.
Yeah.
There's a study like that?
There's a study conducted by Harvard Medical School or Harvard Business School.
Why? Because instinctively you have more clinical experience, Indian doctors.
It's the passion. See, our culture is caring. Our culture is caring, and if somebody is in pain, our reaction to the person in pain is dramatically different than a lot of the other people. Yeah, we are a very caring group of people. Yes, it is in our blood. How will you? Hospital is not the best place to work. I keep saying, I see 60, 80 patients. All of them come with pain, suffering, fear of losing someone, and you have to constantly keep a smiling face and talk to them. You need to be made of a different material to put up with this a whole lifetime.
How can nursing schools increase? What can be done?
See, this is the country which is blessed by God. If tomorrow Ministry of Health decides that instead of producing 2.5 lakh nurses, we should double the number of nursing seats. And we want to do it within, say, 1 year. We are the only country in the world we can do it, where it can be done. All they have to do is, they should just say that any hospital with over 100 beds can start a nursing college.
It's not happening now?
No. It is impossible to get a license to start a nursing school in city of Bangalore. It is not possible. In no metros you can start a nursing college.
Why?
Because I do not want to give you the exact reason, but there are a lot of hurdles in getting the license. And you can start a nursing school in places where there is no hospital, outside the metros.
They want to incentivize
I don't want to... Existing nursing colleges may not like new nursing colleges to come up. Anyway, see, why we should have hospitals becoming nursing colleges. Today, large number of nursing colleges are not affiliated to a hospital. They are not owned by the hospital.
Okay.
Now, when I have a 100-bed, 200-bed hospital, I want to become a nursing college, then I'll be very happy even with the low fees or no fees, because I will have these boys and girls working in my hospital for 4 years at no cost, at no salary. Right? And after 1 year of nursing training, they're as good as trained nurses.
Yeah.
Whereas a standalone nursing school, which comes up in a shopping mall all over the city, those students do not get exposed to the hospital. Yeah. So after 3 years or 4 years, they have the license to be a nurse, but they don't have practical experience. Yeah. Whereas a hospital-based nursing school, the nurses when they graduate, they will be very, very skilled.
But like, for example, I'm asking you very basic questions, doc. But why, for example, why is your hospital not tied up with, say, a nursing college in Ranchi, that whoever graduates from there, you come to mine? That would be the logical thing.
See, unfortunately, I'll give you one example. At the age of 18, some boys and girls decide to become pilots. And they join pilot training institution. At the end of 10 months, they're allowed to fly a plane with the passenger in it. 10 months. At the age of 18, some boys and girls join a nursing college. And at the end of 4 years, they come up with BSc degree, but good number of them may not even know how to check the blood pressure.
Why? It's so
Because they are not trained inside a hospital, whereas a pilot training happens in a cockpit. They don't spend a lot of time in sitting in a classroom and talking about how the plane flies. So our basic problem of our education in medicine, in nursing, is that they're all taught in a classroom or in a library. If you want to swim, you can't sit in a library and learn how to swim. You have to get into water. You spend, more a year reading about swimming and get into water, you will drown.
So when, for example, when I was just telling you about in some hospitals where they say that, we train the nurses how to deal with these kind of situations. They are excellent. As soon as they become perfect, within 2 years or 3 years, they get jobs in the Middle East, they get jobs, and then they leave. Now, how do we have new crop of, instead of complaining about the situation, of course, everybody has a right to go abroad and do better and then transmit money back home, do well in life. Many of those who get into this paramedical profession also come from lower middle class families. So it's amazing that they are improving their quality of life. But how do we get more graduates to get into the nursing profession?
You see, we need to double we have about 2,500 nursing colleges. We need to double the number of, double or triple the nursing number. Because all of us want poor people to become rich. The only way poor people will become rich is by education, especially nursing education. I'll give you one example. We run a hospital in Cayman Island, which is very close to US, near Miami. We have over 100 nurses who are working there in our hospital, and almost all of them are sending home every month at least 1 lakh rupees. And they are only 23, 25-year-olds. Tell me which girl from a poor family from rural Tamil Nadu or Karnataka at the age of 23, 24 can send home 1 lakh rupees. There is only one profession. That is nursing education. Then it is logical that all the policymakers should start thinking about how do we produce more nurses, because there is a global shortage of nurses and India alone is short of 2 million nurses.
Click here to watch the full episode.